Welcome, and thanks for joining us to help choose home when care is needed, a podcast all about the benefits, value, and safety of receiving care and services in the one place that feels most comfortable, wherever it is that the person needing care calls home. I'm your host, Marilee Orsini, and I've been involved in healthcare at home since 1981. Before we meet today's guest, a brief thank you to our sponsors and partners, the National Association for Home Care and Hospice, Access, and Core Cubed. Today's episode is number 14 of Season 3. Sara Wilson is President and CEO of Home Assist Health, a nonprofit care-at-home company located in Phoenix, Arizona. And we are thrilled to have Sara with us today because she really brings a wonderful, fresh perspective and some good ideas to care at home. Please help me, won't you, and welcome Sara Wilson to Help Choose Home. Sara, thank you so much for joining us today. I really appreciate your time.
Thank you for having me.
Let's start this with talking about your agency, who you serve, what model of care you provide.
Of course. So Home Assist Health is the name of our organization. We are based in Arizona. We are a nonprofit, primarily serving individuals with the challenges of aging and physical disabilities. We also provide services to individuals with developmental disabilities. All are in their home and within the community. So we focus on providing services that enable individuals to pursue independent lifestyles at home.
And it sounds like it makes that services may be covered by third party, or are people paying out of pocket for this service?
Correct. We have a blended payer mix. The majority of those that do use our services are covered through the Medicaid program. And then we do have a small volume of individuals who do pay out of pocket or through private insurance.
So you have been doing this for how long now?
I myself have been doing this for more than 15 years. I've been with Home Assist Health. We opened our doors just about 6 years ago. So we're a rather new organization, but our program itself has been around for greater than 20 years, just under a different entity.
And so tell me, in this last year, how the COVID virus has affected your agency, and the services you provide, and your clients.
COVID has had a profound impact on our organization and our individuals, much like it has in every industry. What we've noticed here is a couple things. One, our leadership and our staff, they're incredibly resilient. Our organization, on the side note, has also been really into innovation. And I think because there's been a focus on innovation and being nimble and responsive to changes in our economy and the market, we were able to move through and navigate the COVID pandemic pretty swiftly, and it really helped us to be ready to respond with innovation in terms of how do we train up, how do we extend our supports into the field, and how do we did drive-by PPE pickups, multiple media training for our direct care workforce and for the families we were serving. And so I think because of our infrastructure and who we were as an organization, we weathered the storm pretty well. We still had a good volume of those that we were supporting that did come to have COVID-19, and some didn't survive as much as we had tried to wrap around support for them and just complications of their disabilities. So we did lose lives, and that was very hard for all of us. We also have challenged with maintaining a workforce, with individuals needing to care for children out of school or other complications in their family's health. We did have an added hit on our workforce.
And how did you handle that? It sounds like innovation and technology was a solution to some things. Was that helpful in terms of stretching your workforce as well?
Not as much as I would like to say it did. Our innovation and our responses helped to prepare our workforce and helped to support our families. But what we are still stuck with is that we're a very person-driven service model. We rely on our individual caregiver to support an individual member living at home. And so we can't really replace or augment that with technology in our service model. So that's not something we've been able to perfect. What we have done, and this is a testament to our HR department, is put in heroes pay. We were able to do sign-on bonuses, return to work incentives, do training in a box, keep it easy to onboard, allow for physical distancing whenever possible through the onboarding process. And so we tried to make the hiring experience feel safe and yet swift.
And let's take just sort of a look at the future. With what you've been through, how does what you've learned and what you've experienced prepare you better for the onslaught of the aging demographics that we're seeing in the future?
I really like this question because I'm going to go back a little bit beyond this last year. We've been talking at great lengths about modernizing home care and better leveraging these vital service to help our seniors and those with physical disabilities to age safely in place with a more comprehensive structure. And how do you, in essence, create these home-based ecosystems of care using your home care non-medical provider? And so I think while we've been talking about this and piloting and putting into practice this concept, it wasn't until the pandemic came that it really came to practice. We did take a contract with our local county health system with Valleywise to be part of their COVID surge preparedness. So because of the work that we laid down in the past, we were able to support our medical professionals and our medical community in transitioning COVID recover patients at home, providing them with non-medical support so that they didn't have to enter the community and go grocery shopping, that we can make sure they understood their discharge instructions and help them triage case concerns before they unnecessarily went to the ED or called 911. So we were able to avoid overutilization and provide real quality support to those patients. So the work we laid down early became helpful in supporting the medical communities and our fragile and vulnerable adults during COVID. And we're now seeing that continue to pick up point forward in expanding those types of services to other patient demographics.
Wow, that is impressive. Is this something that you also are working on a national level? Because I know you serve on the Partnership for Medicaid Home-Based Care, right?
I do. I'm doing my very best to speak from the highest levels to the most local levels to open eyes and opportunities to expand the Medicaid service model that is under the Title 19 waiver that in Arizona allows for a service called habilitation. We see this program used readily in our Division of Developmental Disabilities services, so individuals under that program receive this habilitation service line. What we're wanting to do is open up the Medicaid model to include our elderly and physically disabled to receive this benefit. It's already in our Arizona's waiver, and other states have this waiver as well. So if we can open up this Medicaid funding, it would allow us to provide more comprehensive home-based services that are on non-medical that help reduce costs, improve quality, and allow people to remain at home and aging safely in place. We've established this mechanism for people with intellectual and developmental disabilities. It's available to our elderly and physically disabled beneficiaries as well. It's just not been done. We are starting to see samples of this under value-based purchasing innovation pilots. But if we can get it through a more standardized model, such as habilitation under a traditional Medicaid service line, you have broader reach. You can expand this across a wider network and have more meaningful impact in our population.
And how does that happen? Is that a state-by-state initiative?
It's currently state by state because Medicaid is managed by individual states. The interest on a national level is to help open up the eyes of other states and to help into being more creative with this model of care, the Medicaid model of care. And then to also influence, Health and Human Services and CMS to encourage and invite opportunities to modernize home care for this high-risk population that we're talking about.
I mean, that just seems like a no-brainer. Is it that much more expensive for state to do this? I mean, what's the blockage?
I think the blockage is just you have a changing practice takes time. And we have a lot of people who've gotten really good at maintaining their practice. And now we just need to say, okay, you've done this really good. Now let's just do this also. And so it's working with our states to build into their budgets the habilitation code so that if it's a managed care organization, which Arizona is run through managed care organizations, or if it's your state Medicaid management authority, to map out the funding for those habilitation codes. And then it's included in the federal match. So it's just building the infrastructure and the cost controls and then expanding these service specifications through your management entity for the providers to then opt into with their contracts.
Goodness. And I'm assuming that is work that is being done at the national level by your committee that you serve on.
It's not to date, but we're working on it. I'm working desperately to, and there has been some other pilots in other states that prove it works. The work we're doing shows it works, that we have evidence now that shows true value, quantifiable value, as well as qualitative value. So we're using that as evidence to say, look, it's now time to pay attention to this and take some action. So I think we're getting closer, and I do truly believe that the COVID-19 has forced people to look at home care differently and look at how it's being funded. The other important element about expanding the scope of work that we do to include the skill building and health coaching element that I'm using habilitation as a reference for is that it expands your potential for workforce. You're now attracting a new workforce who has a career sightlines into health and human services, where under the current model, you're really leaning into those family caregivers who are essential, but we're missing out on another labor-rich resource.
Now, that is interesting to me. Can you just talk about that a little more? Because I was unaware until recently of the disparity in numbers between the projected need, and the current supply.
Yes. So Arizona is definitely leading the trend in a labor scarcity for this service line. We've historically had a 7-to-1 ratio of support for somebody in need. So 7 people would be available to help one person who is living with an aging or physical disability. We're projected to drop all the way to 1.5 to 2. So Arizona has a rapidly aging demographic. It's going to increase by 40%. Majority of those will be individuals living around the ages of 80. So they're definitely that group that we need to support. And they're also, a lot of them have their own residence. They have a home. And by providing meaningful home-based care, we can save 50% in lieu of facility-based settings. We also reduce cognitive decline by 70%. So somebody who stays home versus going to a facility, we can have more meaningful care. We keep them at home with their loved ones, and we can very naturally integrate with their medical communities, with extended family, to make sure that they are getting the best care that is respecting those health needs as well.
Well, Sara, you are an absolute jewel. I'm so happy that you landed in home care.
Oh, thank you. It's been my blessing.
Oh, good. Well, a question for you. Is there anything that I have not asked you today that you would like to share or like to talk about?
I think what I really would like to put out there a call for open-mindedness. Home care is such a critical resource right now, and there is a large volume of providers that have entered this industry for the right reasons. And we have such an immense and rich boots on the ground support through these providers that can help our medical communities, that can help reduce costs, improve quality. And if we're supported through our health plans and through Medicaid, we can have significant impacts that improve the health for our population and help reduce all of our costs.
And is there something that a consumer could do, someone who's just hearing about this for the first time? Is there some way that they can help, or is this more a policy change?
I think it's more policy change, but I think it's asking questions to your healthcare provider. What are my options for home-based care? Asking your health insurance, how can I get non-medical home care to support my living at home? So a lot of self-advocacy in terms of your interest. If I don't want to go into a nursing home because of COVID or for whatever reasons, I want to stay home, asking for your healthcare provider, your health insurance to engage those resources for you. So I would start there. I would just ask the general community to understand what home care is. You can Google us. We have great Home Care Association of America. You have the Partnership for Medicaid Home-Based Care, where you can learn what your benefits and what your options are at home, and then really ask those questions and ask for those opportunities through your healthcare provider and health insurance.
Wonderful suggestions. Absolutely wonderful. Well, Sara, thank you so much for your time today. I'm amazed at how much I learned today. So I need to ingest this, and I really appreciate what you do for the industry. Thank you for that as well.
Thank you for your time. I really enjoyed this.
Thank you so much for listening today. And a special thanks to our sponsors and partners, National Association for Home Care and Hospice, Access, and CoreCute. If you've not done so already, please subscribe to our podcast and take the time to leave a review on Apple Podcast. We are now on Spotify and most other places where you find podcasts. Like and follow us on social media, and join us, won't you, to spread the word and help choose home when care is needed.